But not
And
12,
good riddance.
but not 12 Lemon Field.
One day at a time.
So what happens? Yeah, the new customer, so we service them all.
You have 2 minutes.
Thank you.
I'm trying to compel them to come in, but there's a
Wanna mention
retirement
that,
seminar
yeah,
next
it's like
door.
how can
Yeah, that's why I said
I
there's a
have my
lot of
grandkids
competing
like
things going on.
your talks and your like resources.
You can't.
Hi. Good morning.
Hey, how are you?
Nice to meet you. Wait, do a sign and shake.
Hi.
So we're hoping to make this conversational if you want to sit at the table with us.
It's just a handout of our ERGs that we have, just
Okay.
interested in any.
Please join us at the table. Come here.
Elsie, you want to sit with us at the table?
I don't, I think, I was just gonna observe.
Okay,
Go ahead.
sure. Have you met Jeanette yet?
I'm sorry?
Have you met
No,
Jeanette
I
yet?
haven't.
No, I haven't. Hi.
So you
Elsa
just
just
started?
joined CMS.
Yeah.
Oh, wait, thanks. Okay, welcome.
Thank you.
I am in
Oh,
office communications.
Oh,
I'm based in DC, so I don't.
We work a lot with Jet.
okay.
Yeah,
Okay.
especially with like coverage to care.
Okay.
Yeah, coverage care is one of the things that I help with the outreach.
How are you doing?
I'm good. How are you?
Good to see you again.
Good.
Remind me your name?
Darling.
Darlene.
Mhm.
Okay,
I work with OTS.
that's right. Did that email help today as a reminder, or
It
was
did.
it
I
already?
already had the other one on my calendar, but
Okay.
it was nice to see a personal email. So
Yes.
that was nice.
A personal blast email. Although we're still a small.
We are
Yeah.
small.
Yeah.
Yeah. Well,
So
thanks
as
for
from our
coming.
last meeting, I kept looking at other people as I walked around to think, okay, are they Latin? Are they not? Because you can never tell.
You
Yeah,
can.
you can't.
I was hoping for the noon time slot.
Yeah.
I feel like we have lunch meetings.
Definitely know a couple of other people are gonna.
Most people probably just multitask instead of task.
Yeah.
They're having meetings. I said, okay, let me go do this. I think it's when we're bombarded with meetings and different time slots that I have to do a select which one is more important. So you said you work out of DC?
Yeah, so I'm in the Humphrey building downtown.
Do you live out there?
I live in Virginia.
Okay.
Yeah, most people live in and around DC. Most people don't live in DC.
Oh, okay. I don't know. I just assume people live, if they work around DC, they live around DC. Of course, I'm not great with the whole vicinity.
Oh, I'm
Hi.
Yeah. Please join us at the table.
Nice to see you.
Please join us at the table.
We're hoping to make this conversational.
Yeah, we're gonna make it really informal and hopefully hear some input from you all.
It's okay.
There are folks on the phone. We'll be starting in a few minutes.
We'll let the late person come and sit next to me.
We're just passing a sign-in sheet around for everyone.
We need some Latin music.
I will never never say no to that. We're actually, there's a local organization that is organizing the first LGBT Hispanic night in Baltimore this weekend. Yeah, it's great that there's some community building going on. Yeah, get to brush up on my bachata.
We'll get started in briefly. If you're on the lines, just a reminder to go ahead and mute your phones until we open up for questions. All right, so we're
Yolanda, do you need to sign the sheet? It's over here.
We'll go ahead and get started. Welcome, everyone. My name is Donna Peterkin. I'm the Director of the Affirmative Employment Group in the Office of Equal Opportunity and Civil Rights. I'm sorry? Okay, can everyone hear me on the phone?
Yes. Yes, I can hear you. Yes.
Thank you.
Yes.
All right. It is my pleasure and honor to open up this Latinx event today. The name of the panel discussion today is Embracing, Enriching, and Enabling Our Latinx Stakeholders. Each year from September 15th through October 15th, our nation celebrates the rich history and cultural traditions of Hispanic Americans. This year's theme is Embracing, Enriching, and Enabling America. This theme speaks to Hispanics and Hispanic Americans' continued efforts to embrace the United States of America as the beacon of hope, the land of opportunity, and a place where everyone with determination, self-discipline, and hard work can achieve his or her goals. Hispanic Americans not only embrace America as its culture, but they also enrich this country by bringing their own traditions, culture, language, values, work ethic, and ideals to the table. Hispanic Americans contribute to the defense of this nation, the arts, sports, public service, research and development, nonprofit organization management, civil rights, politics, business, agriculture, and the service industry to enable America to maintain its competitiveness and position as a global leader of the free world. I'm proud to introduce Latinx because Latinx is one of our newest reformed employee resource groups. Employee resource groups are voluntary, employee-led groups that serve as a resource for members and organizations by fostering a diverse, inclusive workplace aligned with organizational missions, values, goals, business practice, and objectives. Part of Latinx's mission is to work as a strategic partner with CMS to identify and engage CMS employees of Hispanic and Latina heritage in order to promote community engagement, broad collaboration, and increased understanding of meaningful outreach. It is Latinx vision that Hispanic and Latina representation shall be evident in all CMS career tracks, from entry-level positions up through the senior executive series. If you're interested in joining Latinx, please email latinx@cms@hhs.gov. We do have a one-pager here that outlines all the employee resource groups here at CMS, so if you're interested, please join up. And also, if you want to join any other group, you can contact my office, the Affirmative Employment Group within OEOCR. Today's panelists will discuss Latina enrollment in the Affordable Care Act in the marketplace and the CMS Equity Plan for improving quality in Medicare. So right now, I'd like to go ahead and introduce the panel. Ms. Jeanette Contreras serves as a lead outreach specialist in the Partner Relations Group of the Office of Communications at CMS. In her role, Ms. Contreras leads national stakeholder engagement for outreach and education to diverse communities across the United States regarding Medicare, Medicaid, the Children's Health Insurance Program, the Health Insurance Marketplace, and the Affordable Care Act. Prior to coming to CMS, Ms. Contreras served as a congressional liaison in the Office of Government and Congressional Relations at the National Cancer Institute of the National Institutes of Health. Other career highlights include serving as senior advisor in the Office of Minority Health at the U.S. Department of Health and Human Services, and as a senior advisor to the White House Initiative on Educational Excellence for Hispanics. Our other panelist is Mr. Jordan Luke. He is the Director of the Program Alignment and Partner Engagement Group at CMS in the Office of Minority Health. His group is responsible for working across CMS programs, policies, models, and demonstrations to ensure the needs of vulnerable populations are met. He leads the CMS Equity Plan for Improving Quality in Medicare, a 4-year plan to increase health equity across CMS programs, and his team has developed several resources to support actions that reduce health disparities. Mr. Luke also leads a research grant program for historically Black colleges and universities and Hispanic serving institutions. Prior to CMS, Mr. Luke championed health equity as the Director of Quality at Cigna, where he was trained as a Six Sigma Black Belt. Please welcome me, I'm already here. Please help me in welcoming our distinguished panel and thanking them in advance for their commitment to CMS as well as to Latinx. We're going to start with the panelists just giving us an overview of what they're doing, and we're going to kind of have a Q&A going on, so we encourage everyone's participation and questions.
So I guess I can start, and we just sort of wanted to start with us giving a little introduction about the work that we do here at CMS. So I sit in the Office of Communications in what we call the Partner Relations Group. I lead the national stakeholder engagement, as it was said in my bio, and so I wanted to just say what that looks like for the agency. So in terms of the Marketplace and the Affordable Care Act, we have resources like healthcare.gov, right? Our Marketplace call center where people call to get enrolled. So we have a number of resources that we produce, and we help our stakeholders, understand the programs, they understand the Affordable Care Act, and that they have the resources to help raise awareness in their communities and to educate their communities, their members, about our programs. So I do work across all programs, not just the Marketplace. So, my portfolio is working with Medicare groups, with Medicare stakeholders, with Medicaid and CHIP stakeholders as well. Not just the Marketplace, but the Marketplace does take, I would say, a big chunk of our efforts as a team, particularly now. For 3 months out of the year, we focus on open enrollment, and we take several months in preparation, and then several months in debriefing on how we can, do it better the next year. So it is a big effort. So the types of engagement that we do with our national stakeholders, things like partnering on webinars. We are invited to their national conferences, and so we broker speaking engagements for senior CMS officials to give talks or to serve on panels, things like that. We also exhibit at their national conferences. That's one piece. The other is we also engage with stakeholders on different areas like social media. So sharing our content or sharing press releases that come out on different policies, especially as we were implementing the Affordable Care Act and different rules and regulations now that are coming out on the quality payment program. As you can imagine, we're just trying to ensure that our stakeholders are getting the updates on our implementation of the different programs and understand it and have a place to go to for questions and policy questions. So. That is a sense of what we do here and what I do and where I sit. And I guess I'll.
Thank you, Jeanette. So first off, Donna, thank you for facilitating this and for your team for helping coordinate, Latinx, and we're really excited to be a part of this employee resource group. So I've not been very long in CMS. I've been here for about 6 to 7 months. I've changed my password twice, and I still get lost in the building occasionally. But one of the things I most often get asked is, how did I end up in the field of health equity? As Donna mentioned, my group is called Program Alignment and Partner Engagement Group, and we're in the Office of Minority Health, and we collaborate closely with CMS stakeholders to embed equity across policies, programs, and resources that are being developed across CMS. We're actually a fairly new office. We were created under the Affordable Care Act, so been around for about half a decade. Still a pretty small team and a very close-knit family. So I'll be talking today about some examples of resources we've developed and different ways that we've collaborated across CMS. But to go back to that original question I mentioned is, how did I end up in this field? So there's a lot of reasons how I ended up here, but one of the contributing factors was my parents were missionaries, and I was born in Mexico. So I lived 10 years in Mexico, and then we moved from Mexico to Chile, or Chile, and so we also lived there for 10 years. And so I had a chance growing up to see firsthand disparities and the impact of poverty and discrimination. There were a lot of things that I was able to see as a kid, and so those things really moved me and developed a lot of my passion for this work. And then it eventually, working in healthcare provided a good avenue to start to make a difference, because we're all making a difference today. And as we go through these questions, we were hoping to make this as conversational as possible. So, as Donna asked Jeanette and I questions, there's obviously a lot of work underway across the agency around embracing, enriching, and enabling our Hispanic stakeholders. So if there's any things you would like to add, feel free to jump in, because we want this to be as conversational as possible. So, and those on the call as well. So, thank you.
Thank you. All right, so we're going to open up the discussion with a question that the panel presented to my team. So I'm part of the Office of Equal Opportunity and Civil Rights, and we're tasked with ensuring that, well, part of our obligation is ensuring that CMS maintains a model EEO program. And specifically to this question, we're tasked with ensuring that we recruit a diverse workforce and that we create and cultivate a culture where everyone feels included. So, are we bringing in diversity? And when we bring you here, are we giving you an opportunity to thrive and excel? So the first question that was presented is, how is CMS engaging Hispanic employees and/or conducting targeted outreach to increase Hispanic hiring in the agency? So the response here is from the Office of Human Capital. To increase the pool of Hispanic candidates employed during fiscal year 2016, CMS participated in several hiring, career development, and diversity inclusion events. These events included League of United Latin Citizens, which is known as LULAC, Emerge Conference, LATPRO and National Society of Hispanic Professionals Career Fair, LULAC Annual Convention, targeted recruitment meetings at 2 Hispanic serving institutions, and the Hispanic Latinos Professional Association Career Fair, engaging over 260 Hispanic candidates. Additionally, throughout the year, CMS utilizes a variety of tools and strategies to ensure that we are attracting a diverse workforce at CMS, and that includes analyzing applicant flow data. So even if we're going out and we're recruiting, are Hispanic candidates applying for jobs? So we're analyzing the applicant flow data to see how our recruitment efforts are impacting that targeted pool of candidates. We also look into conducting barrier analysis to determine whether there's a CMS policy, practice, or procedure that's impeding equal opportunity. So, for example, applicant flow data is one part of that. So if people are applying, is there something going on the selection panel or the rank and a rating, or if they are selected and they're not promoted, is there some type of barrier within the agency? And so we look to see if there is in fact a barrier and how to eradicate that. And also continuing with our coordinated efforts with OEOCR, Office of Human Capital, our employee resource groups, as well as the department, to make sure that we are attracting and retaining a diverse workforce. So the first question I'll open up, which will pertain specifically to Latinx, the employee resource group. What are the goals of Latinx employee resource group?
So I'll start off and say that one of our primary goals is to create a sense of community here with the Latino employees, and that helps with retention and for us to help support each other through professional development, like programs like mentorship and ensuring that we know about or participate in the CMS professional development programs here. So that's one of our goals, is definitely to create that sense of community here amongst the Latino employees, and then just that inclusiveness of friends of Latino employees to join. So there's my plug to say, even if you're not Latino, please feel free to come to Latinx meetings and support and just be part of our community and what's going on. But I would say more importantly is that we serve as an advisory group to the agency on different things like stakeholder engagement. Are we working with new organizations for Hispanic outreach for recruitment and retention? So we can leverage our relationships with organizations like LULAC and maybe provide new ones for CMS to then do recruitment and outreach there. And then internally for even all of the across the other CMS program initiatives, I would say that, Latinx know that we're formed, we can serve as an internal resource for any CMS program areas or initiatives that are looking to do Hispanic outreach and maybe wants some inroads for relationships.
Yeah, and to build upon that, another goal of ours that we talked about was obviously diversity is the primary goal of Latinx, and one of the ways that we achieve that is by fostering meaningful work that relates to addressing the needs of Hispanic and Latina beneficiaries. And health disparities are of course a problem, and we'll talk a little bit about that today. So we did embed that within the goals of Latinx. And I've seen that on the private sector side, where diversity and inclusion efforts that are closely collaborating with groups that are doing social justice or health equity work within the organization, it makes the recruitment effort more compelling. The work is meaningful, and then people can see that it's not just a job where they're plugging in numbers, that they can make a difference for their community. So that's
definitely. I'd like to also put in a plug for our ERGs, and I met both Jeanette and Jordan at your orientations for the supervisory orientation. We have 8 employee resource groups here at CMS. I would say about 6 of the 8 are extremely active and are getting to the point where Latinx is. Jeanette raised a good point in that you don't have to be a member by, race or ethnicity. You can be an ally for those groups as well, and there's going to be a lot of cross collaboration, and there is a lot of cross collaboration through the ERG. So you may have an interest in something that Latinx is doing, or you may have an interest in another group, and you all may be able to collaborate. So I do encourage everyone here today to spread the word about Latinx as well as the other ERGs, and encourage you all to participate.
And I think our next meeting is November 9th.
Yeah.
Is that right?
Yep.
Yep, so it's November 9th. I think it's 12 to 1. Mm-hmm. So if you can join us, you're more than welcome. We will be talking about what we want to accomplish in 2017. So we're wanting to collaborate with everyone that's already a member, and hoping that you'll help us grow our Latinx family. But think about how we can advance the goals that we just talked about.
Okay. What help does CMS provide to Latinos and Hispanics during open enrollment season?
Okay, so that would be a question for me. So the types of resources that we provide to our stakeholders are like webinars, what we call webinar trainings, where we actually go into what is the marketplace, or best practices for outreach to Latino communities. We've done that to our different stakeholders and done it with and in partnership with our stakeholders. So, for example, we'll host a webinar and do a training and sort of do the high level and then invite a partner to join and talk about how they use the resource or show how that works on the ground and at the community level, sort of to complement our work. The other thing we do is we provide in-language outreach resources, particularly for the Latino community, which we do research on the best ways to communicate, and we still find that there's a need for in-language resources for limited English proficient communities, and so we, I think, do a fairly good job with our cuidadodesalud.gov Facebook website, which mirrors healthcare.gov. And with that infrastructure, I feel like that helps us to then create content for our Facebook page. So we have Cuidado Salud Facebook, we have all the social media channels. We also have just about every training, all the fact sheets in English and Spanish. And so the agency's done a great job in terms of Marketplace and Medicare as well. I've done a lot. I've seen all our Medicare fact sheets and handbooks and things on preventive services, all really popular brochures and publications are done in Spanish and English. So that really helps. And so aside from the print publications, online resources, our sort of webinar places, for open enrollment, in-person application assistance, enrollment assistance is really key. And so one of our goals is right now during open enrollment is to ensure that we're recruiting or encouraging more of our community-based organizations that serve the Latino community, that are already in the community, to get certified as certified application counselors, so that we can have more like boots on the ground to help people enroll in person. We find that particularly in the Latino community, they seek more in-person assistance. They're enrolling more with the assistance of in-person navigators, and so that's really key for our community. So, for example, we did a webinar in Spanish 2 weeks ago, and we got 4 people in 4 different areas. One was from Seattle, one in Chicago, one in the Atlanta area, and one in Texas. They were saying, how do I become a certified application counselor organization? And so I, connect them to the regional offices. And so that's, where I feel like we're adding value is engaging with our national organizations on things like webinars. It seems kind of nebulous, like you do these webinars, but the people that are listening, in the Q&A, they're like, yeah, I want to help. And that is so critical if I can convey that message that we need help for in-person enrollment assistance in the Latino community. And so that's one of the things that we do during open enrollment.
Okay.
Yeah, and a lot of our work, of course, is actually in collaboration with Jeanette's team. One of the things that we've worked closely with the Marketplace team is looking at language data to identify needs of enrollees, and so we've been working closely with the team to analyze that data, and we always work within a framework. We call this the USA Path to Equity, which is building, understanding, identifying solutions, and taking action on disparities, and all of our work fits in one of those 3 or all 3. And so we work closely with the team to develop processes around identifying the language needs. So that's been, I think, that's an important issue, of course, to the Latina, Hispanic community. And I think we're making progress. I think there's opportunity to do a better job in capturing that data so that we can be customer centric and meet the needs of our beneficiaries.
Thank you. I think you both touched on this, but I'll ask, how is CMS collaborating with organizations or stakeholders to encourage the enrollment of Latinos and Hispanics in the marketplace?
Great, so I'll start. So it's sort of the same way of saying like about webinars and brokering, you know, getting CMS officials in at the national conferences, in regional meetings and things like that. And also our regional, like chief medical officers and stuff, sometimes we can have them come down and meet at where our national stakeholders are having their regional meetings and things like that. So in addition to that, for the Marketplace Open Enrollment, we have a wonderful Latino ACA coalition, and it's over a dozen national stakeholders group. LULAC is one of them. It's the National Council of La Raza is a big one as well, most people know. But it's really a diverse set of people. It's, you know, all the way from the National Immigration Law Center to Planned Parenthood, Families USA, so all these organizations that are interested in working on Latino outreach for the Affordable Care Act and Open Enrollment and Medicaid expansion, so they do a lot of advocacy for that as well. We come together and we meet as a group, and so CMS is an invited member of that coalition, along with, because it's run through the White House Office of Public Engagement as the lead with the Secretary's Office, so the HHS Secretary's Office of Intergovernmental and External Affairs. They're the co-lead on that coalition, but it's a really powerful group. So anytime we launch a new initiative like Coverage to Care had launched a new batch of Spanish language materials, I go to the coalition and say, here are the new resources, here's sample content for you to share via social media, here is, you know, a way to share it via newsletter with your members. And so we sort of pre-package everything for our stakeholders to share, and then they share it with their networks and however they do it. So different, you know, stakeholders have different channels of different ways that they're that they show support and that they share out our resources. But so we want to make sure that they know that, you know, we're constantly producing the resources for them and make it easy for them to push it out.
And Jeanette was mentioning Coverage to Care, which is a resource that's developed out of CMS, Office of Minority Health. So we collaborate closely with Jeanette on that. We've actually hosted several listening sessions with various stakeholders this year to gather feedback on what audiences and our stakeholders need to make progress on not just coverage, but also care. And so as we're developing these resources, we always want to get input from the end users of what we're developing. So we don't just develop something, we actually have a robust process within our office we recently had one with around healthcare workforce in San Francisco. And then a few months earlier, we had a listening session around disability. So there's a variety of topics that we're engaged with to guide us in the development of these resources. I imagine that there's probably other work occurring across CMS in these areas. So does anyone else have anything else to add? What do you want to repeat the question, Donna?
Sure.
And then I can just add that a lot of our national stakeholders also serve as validators, because sometimes we'll implement something and have an initiative and we'll get that feedback on, you know, pluses or, you know, what are the good points and what are the bad points about it, you know, and so we often like to value those relationships for that input that we get as there are sort of our validators in our programs and what we do.
Okay. So the question was, how is CMS collaborating with organizations or stakeholders to encourage the enrollment of Latinos and Hispanics in the marketplace? Is anyone in the room or on the phone that would like to share some information regarding that?
Yeah, and if you want to introduce yourself and what office you work at, so I guess there's some context.
I feel like Anderson Cooper at the debate. Channeling that. Okay, so we can move on. If people do have comments or questions, feel free to speak up.
Yeah.
All right, so this is an area, I definitely like this question because this is an area that I've seen through the Office of Minority Health and throughout HHS, and I think it's extremely important and critical to the work that we do here in the agency. How is CMS addressing the well-documented disparities in healthcare for Medicare beneficiaries who are minorities?
Okay. So during the intro, Donna mentioned the CMS Equity Plan for Improving Quality in Medicare, which is the strategic report, if you will, of how we're tackling this important issue as an agency. There are 6 priorities in that equity plan, and I'll just briefly go through them because you'll hear examples as we go through these questions of what are ways that we've accomplished some of these priorities. But priority one is to really improve and expand the data collection so that we can identify where these disparities are at. Priority two is around the evaluation of the impact of these disparities and integrating and embedding equity across policies and programs in CMS. And then priority three has more of an external facing approach, which is to disseminate these best practices with our stakeholders. And then priority four is focused on strengthening the workforce to meet the needs of vulnerable populations. Priority five is to improve communication and language access for individuals with limited English proficiency. And then priority six is to increase physical accessibility to healthcare facilities. And so that's an example of our strategic goals. And I think you'll see that we're accomplishing this one in Latinx by embedding it within the goals of our group, because we're together we're stronger in this area of reducing health disparities. But this is strategically what we're doing as an organization, and later on I'll go through some examples of what that actually means with actual resources and policies that we've partnered on.
What resources does your office
There you go.
provide? Yep, this is it. What resources does your office provide to help address health disparities?
One resource that I think has been talked a lot about is Mapping Medicare Disparities tool. We recently, and this is very relevant to Latinx, we recently enhanced the tool a couple weeks ago by adding data to the U.S. territories, including Puerto Rico. And the Mapping Medicare Disparities tool includes 18 chronic conditions that can be stratified by race and ethnicity, gender disparities, age, dual status. So you can actually now go to, let's say, rural Puerto Rico, right? There's some areas of Puerto Rico that are actually rural, and look at, let's say, the diabetes rates, which are actually almost double to that of Alabama, which is shocking, right? So we're developing resources to help us continue to identify where there's some big needs with the Latino and Hispanic community. We're also building a portfolio of work called Building an Organizational Response to Health Disparities. So it's great that we've identified disparities, but we need to roll up our sleeves and develop solutions and start to take action. That's a less crowded space. The building understanding and awareness, there's been a lot of work over the last few decades, but we really need to make progress on developing solutions and actions. So we developed a resource guide that actually shows organizations simple steps that they can take to start to tackle these problems. And that really consists of five simple solutions. How do you collect, and it in a way it mirrors some of the priority areas. How do you collect and analyze your data? How are you embedding equity within your quality improvement work? What type of interventions are you developing for vulnerable populations? And then do you have a culture of equity within your organization that supports this work? So that's the first series of much more to come that we're developing as an office, but that's an example of ways that we're advancing equity and we're making a difference, or at least trying to make a difference in our space. But we're finding that actually those two resources are being talked a lot about because of the utility that organizations have in them.
Yeah, and I wanted to add that and highlight the Coverage to Care initiative, because access to healthcare is one of the big, greatest solutions for eliminating health disparities. But the Coverage to Care initiative is our health insurance education. It's basically the step two of, now that you're covered, now let's get you connected to care, get you connected to a provider. And for our Medicare population, it's getting them to that wellness visit every year, and what are the barriers? And so I feel like Coverage to Care addresses it to that organization, to that population as well, because it talks about, how to, prepare for an office visit with a provider, what questions to consider, what to anticipate, what to look for in a relationship with a doctor, and so I feel like it really helps or empowers our beneficiaries and our new marketplace consumers on how to navigate the healthcare system, how to advocate for themselves, to empower them to get the most out of having health coverage and not just be passive. So we often sort of, particularly in our community, feel like you only go to the doctor when you're sick. And so we have to change that culture around to, okay, well, this is something you have a benefit to. You have preventive screenings you should be taking advantage of, and develop a relationship with the provider or a doctor so that when something does go wrong, you can catch it early and, as we say, treat it at the onset instead of when the disease or a disease is further along. So I feel like that coverage to care initiative and all of those resources are really helping. They're all, again, done in several different languages. Now I think I lost track. I think there are over 9 different languages. So that's really helping to address, I think, health disparities and health equity.
Okay.
I had a question. So when you were talking about the resource mapping disparities, is that something that's open to the public, or is that
Yes.
just CMS?
Yes, so the data, you can't see obviously beneficiary data. It's the aggregate of the county information. And it's mostly chronic conditions, but you can stratify the data by race and ethnicity, gender, and
How would I
dual
find
status.
that resource?
You can find it at CMS OMH page, but sometimes I'll just Google mapping Medicare disparities tool because it's the first hit that pops up. And there's also a downloadable feature of the map. So if you're doing, let's say, a PowerPoint presentation and you want to highlight a local need, let's say you're doing a presentation for a Quinn QIO in Michigan. I'm giving that example because that's something I had to do 6 months ago. So I was able to download the map of the tool to highlight different healthcare needs of that specific region.
Does the information in your office, does it get released as far as when you find a problem or an issue that should be identified, a disparity that you see, where does it go?
Yeah, so we have a couple of reports, data snapshots and data highlights that some are monthly and then some are quarterly, where depending on the different focus of the agency, if there's a focus on cardiovascular health, for example, or diabetes, there's different themes that we'll have to highlight different things that we're seeing in the data. So yes, we do have that, but I think we can make more progress in that area.
Thank you.
Yeah, great question.
So we know in OEOCR that data collection and analysis is critical to eradicating barriers and developing data-driven strategies. So the next question is, why is it important to collect standardized data on race, ethnicity, and language?
Yeah, I think one thing that there's obviously some fear in when this data is collected, what will people do with the data? And so, one of the big reasons why we collect this data is because we know that these problems exist, and sometimes you have to see the data to build the business case for equity, right? There's some pushback for some individuals that feel like disparities don't exist, but when you look at the data, there's no way to deny that disparities do exist. And so that's the first step that we believe is important in taking and building that understanding and awareness. Another thing is, obviously there's a ton of work to do. We're all challenged with prioritizing what to focus on, and so that's another important reason in collecting the data to identify what are the highest needs of how to focus. But one question that we often get is, okay, so I'm supposed to do this. How do I do it? And we've developed a resource for that for organizations around a compendium on collecting race, ethnicity, language, disability data to walk organizations through best practices around how to collect that And we're even expanding into how to collect sexual orientation and gender identity data. And we're even testing that in other languages, because sometimes when you translate something to a different language, you can't do a literal translation, so there needs to be some testing around that as well. So those are some examples of what we're doing in that space.
Yeah, that speaks to cultural competency. So you can't just do a direct translation in it to translate directly. You know, it definitely has to consider, you know, the cultural competency of what you're trying to say. Data collection actually comes a lot into the work that we do in outreach. So for example, we need to know where the uninsured are so that we can effectively target them where they are in their communities, and again, in a culturally competent manner, right? So if we find out they're, you know, in the South, you do things differently in different regions of the country, you know, with different populations. And so data really helps for those targeted outreach efforts. And then on the other side of the coin is if we're able to collect, or we have better numbers for example, Latino enrollment, like who are our Latino beneficiaries, right? How many Latinos are enrolling in marketplace plans? A lot of people opt out of that question, so we don't have really great data, and that's, I think, a missed opportunity, because then we can, you know, share sort of good news of like, so many Latinos are benefiting from marketplace coverage. These are how many people in our communities, and so it kind of helps, you know, right, especially for us to share that good news story, and to build confidence in amongst the community as well. You know, 10 million Latinos already enrolled, you know, can't be bad, right? So it helps. So from a public affairs and an outreach standard, the data perspective, the data does really help.
Thank you. All right. How can we support the CMS equity plan for Medicare within the agency?
Well, I think we all play a role in advancing equity as an organization, as an agency. I think the first thing to do is, you know, we obviously have a lot of work, everyone, on our hands, but to take a pause and consider that, you know, we're all here to improve quality, right? Whether it's, you know, even you know, someone that may not see quality as directly related to their work, there's always some type of quality work in every space. And if we don't address disparities, then we can't achieve quality. I mean, that's the bottom line. And the quickest way to improve quality is by advancing equity, because you're talking about you know, safety issues, access to health care, discrimination, worse health outcomes, so that, you know, it's a really effective, not only is it the right thing to do, but it's a very effective way to advance equity as an organization. So I think we all play a role in having that dialogue and looking at the work that we're doing, because, I mean, ultimately, you know, we're here to serve and serve the public, and what better way to serve the public than serve those that are most vulnerable.
Jordan, you had mentioned earlier that we're stronger together, and Jeanette, you had talked about people wanting to step up and help. So these last two questions kind of speak to that collaborative effort and joining together to make a change. Do you have any resources to help us identify health disparities?
Yeah, I can start.
I can probably share it all of them.
So another resource that we developed, so I talked about the Mapping Medicare Disparities tool that has fee-for-service data. There's another complementary tool that focuses on a totally different space, which is Medicare Advantage. We developed a resource in our office that looks at Part C and Part D data. It's HEDIS and CAPS data, and that includes Hispanic data in there. So that data is stratified by race and ethnicity, and there's a variety of HEDIS and CAPS measures at the organization level. So health plans that offer Medicare Advantage in different counties across the country. So this resource is a great way for organizations that may not have a robust data collection process in place, but they need to take action today while they're developing their own mechanism. this resource exists for them to zone in on some areas to start to address disparities now. For example, one of the measures in there is colorectal cancer screening rate, which is a measure where there are significant disparities, especially with Hispanics. And so for organizations that need to verify that that's an area where there's a need within their contract, they can use that resource that's available to the public.
Yeah, so I would add that if you're interested in reaching out to in your program work with home health care organizations and you want to partner with Hispanic, older American stakeholder group, feel free to reach out. So, our group, the Partner Relations Group, has a ton of partnerships that are, we're able to lend and sort of makes those connections, if not lend support to the CMS program areas. So.
Okay. All right. So I'm a program manager. How can I help my grantees embed health equity into their work?
It's almost like the previous question, but rephrased.
Yeah.
I think, that's why we're here. Our CMS Office of Minority Health, we're here to be a resource for you. We're here to offer technical assistance. And we're not experts, in other areas, but we have a team of strong leaders that are subject matter experts around embedding equity within policies and programs. And so, we are trying to build relationships across CMS to advance that. And to support that, we're developing a process right now to offer health equity technical assistance within CMS, so that teams that are not sure what to do, but they know they need to do something, they can brainstorm with us to develop solutions and actions around equity.
Yeah, I'll add that and put a shameless plug in there that if you're a program manager and you'd like to add or provide additional resources to your grantees, we do a pretty decent job of sort of best practices for outreach, how to reach hard to reach communities, and it's really about how to leverage existing resources, existing relationships in communities, so we can absolutely come and partner and do talks or stakeholder calls or send presentations to share with the grantee leads, and we can also partner with them in their communities and maybe even help them connect with potential partners that they may not already have connection to. So that's the beautiful thing about, I think, our organization is that even though I work with the national organizations, they have affiliates, and I'm always thinking of our regional offices and those local relationships that they have, and saying how can we work together and partner and make sure that we're all sort of one CMS, right? Mm-hmm. But we have a ton of resources that we can absolutely share with our grantees, because they may not know we put out a new Medicare resource. They may not know we have a new marketplace resource or the coverage to care. That they're always providing new resources, and so I feel like there's always an opportunity to share.
Okay. All right. We do have a few minutes left for the panel discussion. I'd like to thank the panel for this informative discussion today, and open it up to folks in the room or folks on the floor, on the phone. If you have any questions, now would be a good time. Also, if Jeanette and Jordan would like to share any more information about either their program areas or the Latinx Employee Resource Group, any initiatives that you're thinking about, or how members of the CMS workforce can contribute and commit their time and efforts and energy to Latinx.
Well, I'll ask, you mentioned QPP. How is your group Oh, okay. So for the QPP, are you and your group already starting to vamp up as far as finding out how to reach the stakeholders on the quality of care?
Yep, absolutely. So we are, for example, we hold regular national stakeholder calls where we have our CMS QPP leads, different subject matter experts come and talk about, the different aspects of it. We have them pretty regularly as we were doing the request for comment, and so yeah, we're actually doing one Thursday. So tomorrow we're having a national QPP stakeholder call. So our team, the partner relations group, sort of organizes that a little bit with the stakeholders, but we work with our CMS subject matter experts and the program people to put that agenda together. So it's definitely a collaboration where I feel like we service the agency in that way, because we can help to bring the audience, you help to tailor the agenda and what we want to say, the message we want to put across. So we're doing a lot with our providers and clinicians and all of those stakeholders.
Is there gonna be data for that? I just don't know, like, as far as, the Hispanic community is, trying to,
Okay.
trying to get data for, when it starts, I think in 18. But I just don't see what kind of data could be useful from the Latin community regarding quality care. Or am I jumping the gun too fast on this?
Might let
I
you speak to that.
So I know that right now that data on the provider race ethnicity of providers is hard to that's definitely a challenge. So I don't have any particular insights or solutions around that at the moment, but I think it is an area where it is an opportunity for us to identify, you know, how effective are we as an agency in meeting the needs, especially of safety net organizations that are serving Hispanic communities. So don't have the right answer, but I concur that that's an area where we.
Yeah, I think we just haven't launched the program fully
Right.
yet, so we don't exactly know the answer to those questions yet.
So my name is Paul McGann. I work in CCSQ. Thanks for the presentation. The panel discussion was really, really good. I do have a question, but I can also help you with your question. So in CCSQ, we have a network of quality contractors from the QIOs to TCPI and a partnership for patients. But there's one more network that's coming out that was authorized by the macro statute for just the reason that you were saying. And it's gone through a number of name changes as QPP has developed. But the final name we've decided upon is SURS, and it stands for Servicing Underserved and Rural Communities. And those contracts are still in a procurement phase, so I can't talk very much about them. But later, I would say this quarter, those contracts will be awarded, and their specific purpose is to recruit and provide technical assistance to providers in small, rural, but also medically underserved areas of the country. So it isn't specifically labeled for disparity reduction, but I think you can see from the description that it's not targeting the Mayo Clinics and the large practices and academic practices in the United States. It's targeting specifically providers that are having difficulty accessing resources to figure out QPP. And as part of those contracts, I think we're going to have access to the data that you're referring to. And my question was, how do you both reach out to other federal agencies? Because I know there's a coordination effort out of the Department of Health and Human Services, but for example, agencies like AHRQ, HRSA, CDC, maybe even FDA, do you have active liaison with other federal agencies?
Yeah, actually we do. So in my work, especially for the Affordable Care Act, since it was an administration-wide effort, we've created, so we have it was a regular Latino outreach call, and it was with all our HHS partners. So it was like SAMHSA, HRSA, us, and a couple of big active ones. And then our regional staff, so we'd have everybody from the regional offices on HHS and CMS regions. Yeah, so ARC isn't one that we generally work with.
So you know, AHRQ publishes the National Healthcare Disparities Report.
Yes.
Which is one of my favorite publications. So that would be a good one if they aren't part of that. They have a lot of the data there.
Yeah, they do. We're well aware of it. Yeah, and the CDC, MMRWs. I mean, yeah, we know all the good stuff. So yeah. We do. I think at least have a group of, like, you know, who to go to, and some of it is comms people, because I'm in the communication side.
Yeah.
But sometimes the comms people again work really closely with the policy folks, sort of like where we sort of, any of the hot topics in our agencies sort of, you know, come through our comms and awareness right now.
Yeah, we're engaged with federal partners a variety of ways. So one of the ways that we're doing that is through, it's called the Federal Interagency Health Equity Team. I had to write that acronym down. It's called FIHET. And it of course includes, HRSA, CDC, NIH, AHRQ. A lot of the stakeholders from HHS are at the table. And we're sharing the work that we're doing within our respective agencies and brainstorming around solutions related to disparities. We also have a federal partners group that meets a couple times a year on the topic of disparities, and that's an even broader net, which includes Department of Justice, Department of Labor, and Department of Education. I believe there's a variety of stakeholders that are present at the table, and same thing but a slightly different scope. So then they're talking about what is the various work occurring around increasing physical access for beneficiaries with disabilities, and that effort's being led out of CMS OMH.
Speaking of partnerships with other federal agencies, this is Kyle Wilson Jr. and my colleague Lyndon View. We're from the Social Security Administration. First, we want to thank you guys for inviting us to join you guys for this conversation today. And I apologize that we're going to take this a little left field, but we're working with our Hispanic Employee Resource Group, and we wanted to know if you guys had any takeaways, any words of wisdom, any advice, any innovative ideas that you guys would care to share with us that you guys are doing in your group?
Well, I know who that is on the phone, Kyle. This is Donna Peterkin. So thank you for the thank you for the question and the partnership. So SSA will actually be coming to CMS in a few weeks to discuss and share best practices regarding our employee resource groups. So Latinx is a fairly new and reformed employee resource group, but I'll defer to you guys to share anything, but we will have another opportunity to speak more in depth about the Latinx and the other ERGs.
Well, I mentioned earlier about making the work meaningful.
Yes.
So thinking about, diversity is the outcome, but how do we get to that point? And thinking about upstream in those recruitment efforts, those conversations that are happening at career fairs with the student that has no idea about CMS, but when we talk about something interesting like the Mapping Medicare Disparities tool that has data on health data on Hispanics, maybe they're completing their MPH and they're interested in diabetes rates for Hispanics. All of a sudden, the work becomes meaningful and alive to them. So I think embedding meaningful work into the goals of the employee resource group is very important, and it's I think it's also a place. One of the things we heard in our first meeting was a lot of our members felt like this is a family, it's a community that's needed and that's wanted, and so it becomes a safe space where you can build relationships with individuals that share different cultural experiences or linguistic languages. That's not a phrase. So those would be my two suggestions.
Yeah, and to piggyback off of that, make the work meaningful. At least here at CMS, I find that people are here because of the mission. They feel good about working here because of the mission, and so I would think that that's one of the things that brings the group together, right? Everybody here is, cares about the beneficiaries, and so I think that's one thing that I would focus on in terms of making it meaningful, and then connecting that, the reason why everybody's here and the reason why we, we enjoy public service, for example.
Okay. Any final questions in the room or on the phone?
I have one quick question.
Yes.
I thought about this right at the beginning, you just reminded me of it. You meet with a lot of stakeholders. Sorry. You meet with a lot of stakeholders, I know you do that well. As a physician, I'm kind of interested in hearing directly from the patient, directly from the beneficiary. So I'm wondering, is there and I realize stakeholder groups speak on behalf of beneficiaries, and that's great, I think that's fine.
Is there a mechanism at CMS to hear, say, directly from Latino or Latina beneficiaries themselves about their experience as a Medicare or a health exchange beneficiary? Like
Yeah.
direct input from the beneficiary?
Yeah, we do for anything, any resource we provide or any update to the website and stuff, we do focus groups. And so that's where we get, regular people in a room and, ask them, how does this sound? What is, like, for example, how do we come up with quality payment program? Yeah, to focus test group that to find the right word for it. Right? We had macro, but we weren't going to call it macro. So, yeah, everything is focus group tested so that we can, come up with a suitable or at least the best idea, best way of naming something.
So those types of groups happen several times a year? Or?
Yeah, there's a whole, like, so in communications, there's like a whole research branch that just does that. Yeah.
And not just once a year, but several times.
Yeah, throughout. Mm-hmm.
So part of what we're doing with the employee resource groups is we have observance themes and events that come out during the particular Heritage Month, and this has been a panel discussion during Hispanic Heritage Month, but we're encouraging our employee resource groups and our workforce to celebrate and promote diversity and inclusion year-round. So I know that this will be the beginning of several events and engagement opportunities with the CMS workforce. And so I'd like to just thank everyone for coming out today. Again, thank the panel members, Jeanette and Jordan. Thanks to OEOCR and the AEG team for helping and assisting with the panel discussion today. And hope everyone enjoys the rest of your day. Thank you.
Thank you.
Thank you. Looking forward to seeing you.
In the states that are out of the ones that we don't often target.
Thank you for coming.
Limited in efficiency, African American, multiple disabilities, to hear what their experience was. No, this one we did through CMS, supplemented their evaluation, just to hear.
Thank you for signing, Pedro.